I am Chander Shekhar Sibal, Head of Medical Division, Fujifilm India, Executive Vice President based out of Gurgaon. India is a huge market and it is having a lot of untapped potential. We have more than 50,000 X-ray machines and every year around 5,000 X-ray machines have been added. So the requirement is huge, and as of now also around 20,000 to 30,000 systems have been installed. Still there is a huge gap as well as the requirement. So the market is huge, the potential is huge, and we have to reach to the every nooks and corner of the country. We have already supplied many machines in smaller places, in smaller towns, tier 2, tier 3 cities. Now our machines are going to the villages, smallest of villages, and we have the reach and basically the service providing ability, which is the most important, that we are able to provide the same service which we are providing in Delhi, Calcutta or Mumbai. The same service quality we can provide it at ETHealthworld or the smallest of the small places. State governments are taking a keen interest in digitizing as Mr. Modi's vision, and this vision is very much in line with the country's vision, and I feel that with this vision we are able to provide the access of the healthcare services to the poorest and poorest people in the villages, small places. And I can tell you that we have recently received a very big order from Andhra Pradesh government for 92 machines to be installed in the smallest of the places. So, and similarly the other governments like government of Rajasthan, government of Maharashtra, so these governments are taking steps to take these things, and it is many state governments are now talking to us, like Himachal Pradesh government is also talking. So many of the state governments are talking to us for the digitization of their X-rays. And the major thing in India, the problem in India is the radiologists. There are only 10,000 radiologists and there are 1 billion people. So basically the teleradiology services and digitization is a very important step for getting a correct diagnosis. So that is going to be the most important. So first of all, everything has to be digitized and put on the packs, and with the help of teleradiology, it has to be reported. So this is the most important thing and a basic step which government has to take. But I think it is going to take some time because India is such a huge country, and not only the districts level hospitals, but rather now we are taking these things, or the government is taking these things to the taluka hospitals, even the primary health centers. So the point of care is important, where the patient is there in a small village, so he should be able to get an X-ray done there, and the report can be transmitted through the internet, so that they can also get some remedy and what is the action required on that. So basically that the two things are very important: the quality, which is the first and foremost, and the mobility, which is the access to everyone, as well as the teleradiology. These things are the most important. So Fujifilm has come up with the new technologies for full field digital mammography, which is able to detect the cancer, breast cancer, in a very early stage. So the screening programs of that kind will help to detect the cancer early, because nowadays when the cancer is detected, it is in the stage 3 or stage 4. So the chances of mortality is very, very high on those stages, and to contain the disease, I feel that these screening programs and the mobile vans or those kind of activities, if can be done for smaller villages, towns, those kind of places where the people don't have any access to the healthcare technology. So the first, the technology has to reach to the people, number one. Number two, then after the technology, the reporting has to be done by the competent doctors. So these two things, if are combined, can change the healthcare arena in India, and more mortality can be saved, the people can be saved, and also economically also it can be helpful, because if we are getting to know at a later stage, so it will be more difficult to contain, and the cost of that will be very high. Treatment is very high. Fujifilm has good technologies. We are the leaders in computed radiography, CR systems, imagers and films. And now we are taking the next step. We have tied up with the Indian company called ScanRay to manufacture the X-rays in India. We are giving our detector technology as well as the softwares and combining the X-rays from them, so that we are able to produce a low-cost machine, which are the people can afford those machines. And secondly, what we are doing, that we are also giving the pack solution, which is called Synapse, which is one of the best pack solutions, but that is costly. So we have also indigenized and developed certain local pack solution, which is cost effective. And with the help of that, teleradiology services can be provided in a smaller clinics, where one doctor can see 5-6 clinics in one by sitting in one clinic only. He doesn't have to visit to other clinics. So those kind of services, with the help of a iWeb solution, we are able to provide to the doctors now. So with the help of these, we are, and then we are launching our high-end machines like full-field digital mammography with 50 micron resolution to pick up the disease at a very early stage. And we are also trying to propagate the training of that machines to the people so that they can learn about these machines, and also we are spreading the message of early detection so the people can come for the screening. Basically, Make in India is a very good initiative, but there are practical difficulties in implementing that because there is no incentivization in manufacturing in India. Rather, India is an import-friendly country where you can import a thing within one day or 2 days, you can get an import license. But for manufacturing, you require a lot of licensing. And also the duty structure is not conducive for manufacturing in India. So those things have to be thought by the government, that what kind of advantages has to be given so that the things can be, manufacturing in India is a reality, so that it can become a reality, not only on the paper or on the dream. So those kind of things government has to think that they have to give some advantages for manufacturing in India, not only the talking, but in real sense they have to give that. In car industry, there is a lot of incentive for the manufacturing in India because the duty is very high. But in case of medical equipment, it is other way around. The duty is very, very less. And the other thing for manufacturing in India is very tough. So those kind of things government has to think to give more advantages for the manufacturing in India. India is a very populous country. It has a huge population of 1.25 billion people, and lifestyle diseases are increasing. The middle class people are increasing, so they are able to access the healthcare. So those kind of things are the positive sides of it or opportunity side of it. But there are a lot of problems also, that there are many people who are not able to access the thing because their per capita income is very, very low. Apart from that, the insurance sector has not been able to penetrate the way it should be. Also, the government insurance schemes, the payment of those schemes are not properly done to the doctors, so they are not able to utilize those insurance schemes properly. So government has to think the infrastructure is very poor at this point in time. So how much infrastructure government can provide to the private people who can come as a public-private partnership to make this, to provide the healthcare to all the people in India. PPP model is a very good way to basically where government provide the land, the building, and the management and the equipment and the services run by the private people. So this is helping a lot, and we have seen that this is a very good model. We just succeeded in past. Only thing is that the corruption level has to come down. So to make it more faithful to the people and to all the parties, it should be a win-win situation. It should not be sometimes the corrupt people who will not make it, these programs are not able to launch and get launched. So those kind of things should not be there. More faith between both the parties, all the parties basically, all the parties which are involved should be there to make it a success. Because until the private people will earn, they will not be able to put the money also, and the repeatability will not be there. So we have to see some model which is win-win for all the people.